Now the iliopsoas is the next release, which also shows how you can use actually very light pressure but achieve a great depth of penetration into the body. So again, these use the myofascial concept. These are very, very gentle. If you force these areas, you will irritate the body or possibly traumatize the tissues. Let's start with the legs down flat. Let's identify where the iliopsoas muscle is. The iliopsoas muscle originates, and we'll just look here from the spine, from the vertebral bodies of the lumbar vertebrae, intervertebral discs, and transverse processes, and it comes down to meet the iliacus muscle that lines the internal bowl of the pelvis, and the conjoined tendon passes just anterior to the hip joint. So you can palpate the tendon, where we will do a muscle play type of myofascial release, just at the inferior medial border of the ASIS, anterior superior iliac spine. You can notice just above the hip joint itself, if you feel on yourself, the ASIS, right above the break in your hip, come to the inferior border, I'll find it on the patient, and medial, and flex your hip up to feel that muscle contract. Let's find it on our patient. Now, because, again, the abdominal area is very sensitive and often very ticklish, approach with a flat hand. So you can feel the bony projection of the ASIS. I palpate it right here. Here is the superior and inferior border of the ASIS. So have your fingers inferior and medial, and ask the person to lift your leg up for me. And release. Feel that tendon pop under my fingers? And it's nice to show the patient also so they understand what you're working on. And this is one of the muscles that comes from your back and helps to move your hip and your back. So if you have a problem with that muscle, you may find goniometrically there is limitation of hip extension, which should be reduced, and you should have a greater hip extension after this release. Now lift up your leg. Feel it jump under your finger and relax. So now he's identified this muscle. Many indications for this would be anyone with back pain, people who have limited hip extension for any reason, be it a high tone problem, joint contracture, or someone who, when ambulating, fails to get good hip extension and they end up hyperextending their back as a compensatory pattern. You want to reduce some of that back pain by lengthening the psoas. So here, let's find a tender point. Any tenderness in here? How about compared to here?
First area was somewhat.
This one's more tender. So I feel some taut bands in here. It feels like you can play guitar in that muscle. What number would you give that pain on a scale of 0 to 10? If 10 is extreme pain and 0 is no pain.
7.
That's a 7 out of 10. So always check your visual analog pain scale on a scale of 0 to 10. How much does that hurt? Check that before and after the release. So I've identified the tendon. I'm now going to use a combination of something called counter strain, which was developed by Dr. Lawrence Jones. And that involves bringing the hip passively to about 90 degrees or a little bit above, and holding that position so that the patient does not have to hold his leg at all. It's completely passive. I'm still palpating the tendon here, just medial and inferior to the ASIS. I'm going to apply a little pressure to the border of the tendon, like muscle play, take up the slack where it was tense. Any pain?
No.
How much pressure do you think I'm putting on you?
Minimal.
Minimal pressure. So the pressure is very gentle, and I'll simply hold this release for 90 seconds. Now you don't want to do a half of a psoas release, so wait until the pain is reduced at least 50% before releasing the tender point. Otherwise, sometimes it tends to become a bit more aggravated in my experience. So we'll hold this point right here. Now while we're waiting for this muscle to relax, focus on breathing into your belly. So you're going to teach the patient some diaphragmatic breathing exercise. Very soft, feel that the breath comes more in your belly, not so much in the chest. Now I'm monitoring the point here, and I could again imagine the face of a clock over the hip joint or over the very tendon that I'm putting that myofascial muscle play on. I can move my muscle play to a 12 o'clock, 6 o'clock, 3 o'clock, 9 o'clock, see which direction around the clock has the greatest fascial tension, the greatest vector of force, and that is the direction that I'll apply my pressure very softly through my straight fingers, just medial to that hip. I'm getting a little release right there. Feel a little depth. I can now sink my fingers in. What does it feel like?
A little softer.
A little softer. Okay, so I got a release there. Typically I'll do 2 or 3 releases in a given area and reassess, but I'll give you time to try exactly that. Take the patient out of the position very slowly, so as not to cause any stretch reflex. Allow him to come back down into neutral very gently. Now, I have not moved my hand. Check again. Any pain?
No.
No pain. Check again. Go to that other spot that hurt too. Okay, so in 90 seconds, you can eliminate a trigger point with a very, very gentle technique, incorporating positioning with myofascial muscle play.